Okay. Couple questions. And, oh, Becca, you're asking a question that's actually very similar to one that I'm about to answer. So you're right on my page today. Let's see if I can answer this one, and then hopefully it'll answer yours as well. Thank you for the hearts for Lauren. Okay. So the question that came in was from Andrea, okay, and Andrea was asking the question about a milk protein intolerance. She said her baby, she was told that her baby may have a protein intolerance. I'm reading on my computer here, so let's see if I turn this around. Oh, this sun is really, really strong. Okay. She said she was told that her baby may have a protein intolerance. Not sure she believes it, since her first son had the same symptoms at the same age, 5 months, and ultimately was on soy formula, which he would not have been able to tolerate if there was a protein intolerance. At that time, I was told that I had to switch him to formula, and found out later that it was not necessarily true. I'm pushing back this time, but my baby is falling off the bottom of the growth chart. Thinking of continuing to pump while we get this figured out. If the situation becomes more severe, do you have any information about protein intolerance or the misdiagnosis of this? I think there's two separate questions here, because she's asking about milk protein intolerance, that's what the baby was diagnosed with because there's been an issue with weight gain. However, I'm kind of thinking that that's not exactly, like, there's been a misdiagnosis in that. I don't think that's the issue. And like she said, the baby, her last baby, had the same symptoms, was able to drink soy formula. Although some babies with dairy, like a cow's milk protein intolerance, can't drink soy formula, although lots of times those babies are also sensitive to soy, and soy is not actually my first choice when it comes to formula anyway. So that could be the truth. It may not have been. But as far as like falling off the growth chart, that she's saying baby is falling off the bottom. The fact that the baby's falling off the bottom of the growth chart could really mean other things. It has more to do with how many calories the baby's taking in. It really has less to do with the protein intolerance. So I'm concerned that I don't know what the symptoms are that she's talking about, because they may not be the ones that are indicating a milk protein intolerance. I think what I want to say is that when it comes to milk protein intolerance, and I know that Becca just asked the same, was it Becca, was it you, who asked the question about what do you look for if your baby has a dairy allergy? So dairy allergy too is different than, dairy allergy is also different than a milk protein intolerance, because dairy allergy tends to be something that lasts much longer, that lasts into childhood and even beyond. It's something that stays with them. Cow's milk protein intolerance is something that's really, really common and not rare in human babies. So very commonly, human babies cannot digest the protein that is in cow's milk, which is also what is found in infant formulas. And also what happens when you drink cow's milk and you're breastfeeding, that protein does go into your breast milk, and that's what the baby is struggling to digest, okay? Some of the symptoms of that would be fussiness, gassiness, green stools. Those are all like lots of crying and discomfort. That can all be signs of a milk protein intolerance, a cow's milk protein intolerance. And usually it requires you to cut dairy or cow's milk out of your diet completely. And then it could take a good week or even sometimes a little bit more for all of that to come out of your system to know that, okay, that was the problem. So, you don't want to just cut dairy out and then one day later say, well, that wasn't it, because they're still struggling. It could take a long time, okay? But it can go into the milk very quickly within a couple hours of eating something that has dairy in it. And you really have to read labels because it's hidden in different things. So that cow's milk protein intolerance is pretty common. I would say that for most babies, if you're thinking that the baby's struggling with something that you're eating, and I've said this so many times before, whether, lots of times moms are eating very, very little, very bland food. They're not eating spices. They're not eating sauces. They're eating plain chicken and rice, no vegetables, and thinking that's what's causing the discomfort or gassiness in their babies, when in essence, it's really the cow's milk that's doing it. Think about it. Human babies, the protein that is in cow's milk is totally different than the protein that's inside of your breast milk. And so human babies were meant to digest breast milk protein, but not necessarily cow's milk protein, which is much more difficult for them. Not all babies struggle with this, but a lot do. And it always comes down to, moms will say, well, how am I going to cut out all that dairy out of my diet? I'll have to do formula. But that's not really a great answer, only because most of the, formula is made from cow's milk. So they're going to have an issue with it. Those are the babies that really need the breast milk. All right. So you want to find the answer there. As far as a dairy allergy, that's an entirely different thing where, that's something that lasts. The cow's milk protein intolerance can last just for probably, part of the year, sometimes the whole first year, but they eventually do grow out of it, and then they're able to eat dairy. Both my children had that. I had the same thing with both my kids. Both of them could not tolerate any cow's milk at all. That means me eating cow's milk, for going through my breast milk. They struggled a lot until I figured out what was the issue. And once I cut it completely out of my diet, they both did fine. And they're both not allergic to dairy at all. By the time they hit a year, they were able to have whatever they wanted. So they do grow out of it, okay? There is a big difference. And that also is a big difference from lactose intolerance, which we can discuss a little bit more tomorrow. Is that something you guys want to hear more about? Cow's milk intolerance, lactose intolerance, dairy allergy. Those are all things we can talk about a little bit more tomorrow on our long Q&A, okay? Yes, cows eat plants. They don't eat dairy. That is true. That is true, Rachel. That is true. Okay. So, and there was one more question that did come in that I want to answer while we're on here, because people are waiting for these answers. And if you do have questions, you know to post them on my Facebook wall, so that when I do these quick Q&As or even the longer ones on Saturday night, I'll make sure that I address them. I will get to them. I might not get to them immediately, but if you post it there, yes, please. Okay, is that to my last question of do the cow's milk lactose intolerance? Yeah. Okay, I'm assuming that's what you mean, Angelica. Beautiful name, beautiful name. Okay, so the other question was, this came in from Sarah. She said, my son is 1 month old. I have been nursing and then pumping once a day to get a supply for when I go back to work. I stopped pumping 2 days ago because I noticed he was spitting up a lot, and I think it's due to my overactive letdown. When we started nursing, he gets fussy sometimes and will latch on and then come off crying. When he comes off, my milk is usually squirting out. The lactation consultant wants me to try block nursing, and we started that today. So I'm concerned that I'll dry up going that long on one side. I'm so scared he isn't getting enough. He nurses every 3 hours, and before we did the block nursing, he did 8 to 10 minutes on each side. Now with the block nursing, he's only nursing about 13 minutes. Any advice would be great. Okay, I understand why you're a little concerned that your milk might decrease from the advice that you got to start block nursing, just because the baby is spitting up a little bit after the after the feedings, or there's milk squirting with a heavier letdown. Block nursing, where you're sticking to one side for a long period of time and then switching to the other to try to decrease your milk supply, that is essentially the goal of block nursing, is to decrease an overactive supply or an overabundance of milk. And if that's not what you're worried about and you're concerned about having enough to go back to work, I'm not sure that it's actually the right advice. Yes, you may have an overactive letdown, and there are other ways to deal with that besides decreasing your supply completely. And there also may be a reason that the baby's spitting up. Couple things that I would consider before I would try to decrease your overall supply. I usually save that for people who are extremely overproducing, having recurrent mastitis, other issues other than just an overactive letdown, or just, a baby that's spitting up after feedings. You can control the feedings in other ways to accommodate that overactive initial letdown, and you can also accommodate the baby spitting up. A couple things is, one, maybe you're not burping enough. Lots of times when you have a really heavy letdown, the baby may be gulping lots of air, especially right in the beginning when the milk first initially lets down. So that first few minutes, it may be like a minute or two into the feeding, and the baby may need to come off and actually burp, and burp frequently throughout the feeding, so that you're getting some of that air up, so that it avoids some of the maybe spitting up later when the bubble finally comes up with a stomach filled with milk. And it will probably eliminate any of those little air bubbles passing all the way through the intestine, where then the baby needs to, it has to go through their intestine versus coming out when it easily could have been a burp right there in the beginning. Other ways to deal with it would be to nurse in different positions, like actually having the baby lay on top of you, where you're leaning back, the baby's laying on top of you, and it's something called laid back nursing, and that way the baby can control the flow of the feeding. Of course, Kate, there, I see you now. Kate, you're always 2 steps ahead of me there, Kate. Okay, so laid back nursing is where the baby's actually, you make me laugh, laying on top of you and more on an upright position, or a more of a superior position to you versus underneath the breast. That allows the baby to control the amount of the feeding, to let the milk flow out of their mouth if it becomes too much, and not have to gulp so hard as it's pouring down their throat. I would say those are better situations than trying to decrease your milk supply, especially if you're going back to work. I would hate to see you do something that is not necessary and can actually be harmful, in the sense that it may not be that you're making too much. It just could be the force of the letdown, the initial letdown, okay? Or the baby's inability to handle that much milk at one time, which they could grow out of too. The milk squirting out when you take the baby off is actually a pretty normal thing. That happens. I don't know how many of you guys experience that. I know I did. Baby would pop off and the milk would spray across the room. But that's what happens, okay? The milk is not just necessarily being sucked out of the breast by the baby, but we're stimulating a hormone response with the baby nursing that contracts the little muscles around the milk ducts that has the milk flow, and forcefully at times. So especially when the breast is at its fullest right at the beginning of a feeding, if the baby happens to pull off, milk is going to spray. It doesn't necessarily mean you're making too much milk, okay? Other signs that it could be an oversupply would be more things like the baby's not gaining even though the baby's drinking a lot. You could have a fore-milk, hind milk imbalance, where the baby's getting more watery milk, less fat. That would be an indication that it could be an oversupply, not just a forceful letdown. The baby's stools could be very green. That too could be a sign that they're getting too much formilk from an oversupply. But from what you're describing here, this doesn't seem, the fussiness, the milk squirting out when the baby comes off, a little bit of spitting up, not necessarily an oversupply, but an issue with letdown and controlling the feedings, helping the baby to control and get less at the initial letdown, or burping them more frequently. Yeah, so hopefully you're getting this. Let's all post on Sarah posted this the other day on my wall. If somebody can go over and just let her know that that I just answered her question during the stream, so that she can come over and watch the replay if she's not here with us. I would really appreciate that. Kate, I'm going to give you a job right now. Okay, Kate? Go over and post to Sarah and let her know. It's Sarah Duncan. Let her know that her question just got answered and she needs to watch this ASAP so she can get the answer. Okay? Kate, I'm giving you jobs here, Kate. All right. Casey, the LC at the hospital had me decreased because I was overproducing, but now I'm going back to work and some issues getting my supply up again, and have some for baby while I'm at work. Yeah. So, yeah, you got to be really careful that when you're trying to decrease supply, that it really is an oversupply, and that it's not just that you have a forceful letdown, like we were just saying. Especially if you're going back to work, you don't want to create issues you don't have. So you don't want to create those issues. You're going back to work and had some issues getting your supply up, but now you have some review. Okay. Yeah, the main thing is, getting your supply up. The best thing you can do is make sure that you're feeding frequently. Feed frequently, pump frequently. Don't let hours and hours go by at work, Casey, when you're, not with your baby. Make sure that you're pumping frequently so that you keep your supply up. And remember, you don't need a ton of milk for that first day back. You just need enough for what the baby's going to eat. If you give yourself a couple of weeks, or even, 2 weeks to pump like an ounce a day for that day that you're going back to work, you'll have enough to leave for that first day back. You don't need an enormous amount, assuming that while you're at work, you're going to pump on a good schedule so that you have enough milk for the second day back. And then you'll worry about a freezer stash or having a little bit of extra in the freezer as you go along. Okay, some of the middle of the night feedings or pumpings, you can grab a little extra there. How can you get your 3-week-old, Jess? Okay, how can you get your 3-week-old to stop clustering at night? He clusters from 1 to 5. You don't. You sleep during the day when your baby's sleeping. I know that's not the answer you want to hear, Jess, but 3-week-olds, that's what they do. That's what they do, okay? So a couple things. One is just make sure that you have a really good latch and positioning. Your positioning and your latch. Poor internet. Poor internet, Joe. Maybe it's Talia on FaceTime. I don't want to, not with the new router. I don't want it. Come on. Come on. Go tell her. Okay. What? She's on FaceTime. That's what it is. Okay. So, yeah, I mean, a 3-week-old is going to eat frequently at night. I think that, what did you say here? I don't mind cluster feeding. I just never get any sleep since I have a 2-year-old too. I literally run on 2 hours of sleep each night since he's born. Okay. The main thing here is that, you need to make sure you're getting a good latch and position. That way the feedings will be much more efficient. But even with all of that, a 3-week-old may just want to nurse frequently at night. And the truth is that those nighttime feedings are what increases your prolactin levels, helps with your milk supply. So he's actually doing the right thing. It's just that you're not getting the sleep that you need, especially with a 2-year-old. I don't know. Jess, is there any way that you can get a little bit of support for during the day, just for the next couple of weeks? It's not going to last forever, but can you get a little bit of support for the 2-year-old, like a little, like a babysitter to come over for a couple hours so that you can get in bed with the baby and have somebody watch your older one? Because I think that, you're only 3 weeks postpartum. You need that time for yourself and for the baby. And I would hate to say to you, don't cluster feed if the baby needs to do some clustering at night. Keep the baby sleeping close to you. Okay, that's going to help. And that way you don't have to completely wake up through the feedings. But that's kind of a double-edged sword, because not waking up completely during the feedings may help you to keep sleeping a little bit more. But at the same time, with a 3-week-old, they're so small that if you don't get up and sort of position right, the feedings could drag on forever, and they may just take longer than they need to because the baby's just not latched properly, and so they're not getting the full amount of milk. You could also try some breast compressions while you're feeding, so the baby's just getting more, because they're just slower in the beginning. They're slower in the beginning. Main thing is, remember that this will pass. So it's not going to last. This is just that first month, that first 6 weeks is super hard. So I would say that's the main thing here. Liz, your 8-month-old is getting teeth and is now biting you. This morning he bit me and drew blood. First of all, before we move on to that one, Jess, can we have some hearts for Jess? Because Jess needs lots of hearts. Congratulations on your new little one, and she needs lots of hearts and love. Let's give her some love, because you know how hard it is in those first couple weeks. Yeah. Okay. You have her going with her dad, with your dad. Yeah. Okay. That's awesome. That's what you need. Ask your dad for some help. Take, wherever you can get it. Everybody wants to help by taking care of or holding the baby. That's not what you need. You need help with your 2-year-old. Yes. Hearts for you. We're giving you lots of love. Lots of love, Jess. Okay. It's going to pass. Liz, my 8-month-old is getting teeth. It is now biting me. This morning he bit me and drew blood. Ooh, is there anything I can do to stop him from biting? I'm now scared to nurse. My first only bit me once, so I've never felt with this. Yeah, well, a couple things you can do that will help the baby, your child to stop biting is make sure that you're not being lazy with your latch. And what I mean by that is that the baby's not hanging off the breast right at the tip of the nipple. When they're not pulled really close into the breast, they are able to clamp their jaws down so they can bite more. If you hold the baby really close to the breast so that their face is really smushed in, their chin is completely smushed in, their nose is touching, their head is slightly angled. I'm trying to show you the direction here, okay? When you do that with the child, it's very hard for them to close their jaws, and so you'll get less biting. You also want to pay attention. Don't do something else while the baby's nursing. Watch the baby. As soon as you feel like they're at the end of the feeding, they're kind of like at that moment where they're done, take them off. Okay, don't just let him linger there because that's when the biting will start. It could be that he's starting to, like you said, he's getting teeth, so he's teething, he wants to chew. Give him something to teeth onto. That biting, that teething it'll make sure that it'll help so that he's not biting on you. Okay, so swap it out with something for him to chew on, something to teeth on versus your nipple. Okay, but hold the baby closer. That usually helps a lot, and pay attention. In comes Joe with the demo baby. No demo baby today. We'll do that tomorrow, Kate, okay? On our full Q&A. You and I think alike. It makes me really laugh. Joe's cracking up because every time I'm about to say something.
You're funny, Kate. That's awesome.
All right, so...
how's the internet stream? Good?
Good. The internet is streaming good. Do you want to say hi?
Oh.
There's Joe.
Hi, everyone.
There he is.
Am I live?
Yeah, he's live. You're live. Good job with the router, babe. Good job. Good job. It's nice and clear, right? I can tell because my mouth is matching up with the sound of my voice, okay, which I know it wasn't doing the other day, and I always see a problem with it. So this is fantastic. So happy about that. Oh, can we have some hearts for Liz? Because Liz and her little bitey baby and her poor nipples. Can we have some hearts for her? That's no fun at all. Biting is a hard one to answer because I don't really have a lot of answers for it. It's just part of like some of the things that go with nursing, and typically it's not a huge problem. And once you kind of take them off when they're doing it and you just stop the feeding, they start to understand. So hopefully it's not going to be a problem going forward too much. I think mine each bit me like one time and I kind of screamed, not on purpose, but it just hurt. And from then on I just paid closer attention because all you need is one time to feel bit like that, to make sure that you don't take your eyes off of their little mouths. Yeah, then it didn't happen anymore, just because they did once. My younger one used to grind. She used to grind her teeth on my nipple. That was the worst. Ugh. It wasn't a biting, but it was this horrible feeling where she would grind her mouth on my nipple there, and I used to just take her off. As soon as I'd see that the feeding was over, she'd come off. And it was like those few weeks when she was really teething was the biggest issue. Okay, good. So we have our winner. I did announce our winner for the inflow. That was Lauren Hansen. Kate, did you tell Lauren? No. Where did I ask? Did you tell Sarah? Kate, did you tell Sarah that I answered her question? I gave you a job there. All right. So I'm gonna just let Lauren know that she's the winner, and tomorrow we will have another little prize for you. So make sure that you leave your questions for me, and I will see you all at 9 o'clock. Oh, and also keep this in mind too. Next week I am flying out to Denver on Tuesday morning. I'm flying out to Denver. to see our very good friend Jamie Grayson, and Wednesday night I will be doing our monthly Even Flow Feeding Q&A with Jamie live from Denver. So I'm super excited. Yay! Hearts for that. Hearts and likes for that. I'm excited to go be with him, and it's been a couple months since we actually did like our normal thing. I think we were 2 months ago, we were in Vegas in a hotel room, and it was like we were exhausted. And then last month we were at the LA Baby Show. It wasn't like a real Q&A. So it's been a few months since we've actually done our regular thing. And I am super excited about that. So I don't know how you feel, but I am pumped up for that. Ha ha ha, pumped, get it? Okay, so make sure you mark that on your calendar. That is Wednesday night, the 5th, was it 6th? Wednesday night, the 7th. It's the 7th, next Wednesday. It'll be 9 p.m. Eastern time. For us, it'll be Mountain, 7 p.m. Mountain time. So join us there on the Baby Guy NYC with Even Flow Feeding, okay? And I'm looking forward to it. Yeah, if you left questions here and I didn't get to them yet, tomorrow night we'll answer them, okay? When you see my post go up in a little while for tomorrow night's Q&A, can you copy and paste it over there, and then I'll make sure that I answer. All right? Have a great night, everyone. Enjoy your Friday night, and I will see you tomorrow. Love you all. Love you. Bye.